Awesome. I think we can go ahead and start right now. Can everybody hear me? Perfect. Oh, there you go. Thank you for tuning into this session. I'm Danny. I will be hosting this session with Dr. Gunton, and it's going to be exploring the vital role of pediatric ophthalmologists. So just before we go ahead into the session, I just want to introduce Dr. Gunton. So Dr. Gunton is a distinguished board-certified ophthalmologist specializing in pediatric and adolescent ophthalmology and strabismus in adults. And after completing her residency and fellowship at Will's Eye, she has been serving as a pediatric ophthalmologist. Dr. Gunton recently published a study on the effects of virtual schooling on children's eyesight, garnered national attention. So adding to her long list of significant contributions, please welcome Dr. Gunton. I'm going to go ahead and stop sharing my screen.
Excellent. Thank you so much. I want to thank both Danny and Alexia for the opportunity to be able to talk to you. It's very exciting to kind of share a little bit of my career journey with you. I have a little PowerPoint presentation, and I guess the format is that we start with my presentation, and then we'll have time for a question and answer. Let's see if I can just get this to start. There we go. Okay. So I would say that most of us, if we mapped it out exactly, would say that our career journeys are not linear paths, and mine is somewhat similar. So, oh, and don't forget, there's always the financial disclosures page. I don't have any disclosures that are relevant to this webinar, but I will be talking about the research that I'm doing for a group called PDIG, which is the Pediatric Eye Disease and Investigators Group. I just thought that this was a funny cartoon. But to start my presentation, I really wanted to share that when you start your journey to become a physician, I think that most of us have worries and concerns. And I want to tell you that at this point in my journey, I would say that the thing that I wish I had known was that you really just need to be yourself, that you are absolutely good enough at where you are right now. So some of the things that I mistakenly believed before I started medical school was, you have to have perfect grades if you're going to become a doctor, and you don't have time to have friends or do hobbies outside of medicine. That it was really important who you were connected with, that was going to make or break it. And that, maybe what you're doing is not sophisticated enough for you to become a physician. And I want to tell you right now, every single one of those things was not true. The best doctors are the ones that can connect. And in order to be able to connect, you have to be excited about your hobbies and have friends and do normal things. I remember someone gave me the advice. I said, well, I don't have time. I shouldn't ever watch TV. And I know you guys don't do TV, but just substitute YouTube. The truth is that's exactly what makes you able to connect. All right. And then to move on, make sure that you constantly check in with yourself about what you want, not what other people are telling you that you should do. So make it a priority if you can, as you go throughout your different career decisions, to just ask yourself, what makes you happy? And you can, if you don't like the word happy, you can substitute content or satisfied. If when you're content, that's a sign that this is a good thing for you. What are the circumstances that are happening when you feel happy? Is it that you solved a problem? Is it that you collaborated with other people? Kind of pay attention to those things so that you can make sure when you make decisions that you move in that direction. And then the last thing is, once you've made a decision, don't worry. You aren't static, and decisions that you make will not bind you in place. Just keep asking yourself questions. I remember when I did my internship, we had to do an internship year before our ophthalmology residency started. And I was so excited because one of the girls doing the internship year with me was going to be in my residency program. And we didn't get to do any rotations together. It was just a really big program. And by the end, she was like, you know what, I'm going to be a dermatologist, not an ophthalmologist. So even kind of late into the process, you reassess, reevaluate. There is no right or wrong. Okay, now I'll kind of get down to the nitty gritty of myself. So I grew up in a little farming town in California. It was a really small high school, and I really did not have that much exposure to research. I knew I loved science. There was something about working on projects or like just learning more about how things worked, which I felt was science, that really just turned me on. And then I went to college at Stanford. My initial interest was in neurology. I still continue to think that the brain is fascinating and that we don't understand it. It's once we learn more about it, it's going to be it's an amazing field. And what I did is I thought that I might be interested in that, and I was taking classes, but your college classes don't really kind of tell you what it's going to be like. And I got advice that maybe I should try to work in a research lab. And so be careful when you decide what labs you want to work in. The first lab that I chose was it was a really big lab. It was, you are just a cog in a wheel, pretty much. This was my little piece that I was supposed to do, and that was it. And I have to tell you, that completely turned me off. I was like, yeah, I'm not going to do research. And then serendipity, I met two people at Stanford, Dr. Daryl Tanelian and Dr. Bruce McIver. Both were in the Department of Anesthesia, which has nothing to do with neurology. They happened to be working on nerve conduction studies. So I was still in I think I want to do neurology, and I went and spoke with them. And their lab was completely different. Dr. Tanelian was a clinical scientist, so he had his practice and he also did research, whereas Dr. McIver was completely devoted to research. And their lab was so welcoming. It was like, come on in, these are the projects we're doing. And then they would actually have research meetings, talk about their projects. They wanted input. We'd literally like build little models and drawings and, oh no, that's not going to work. Okay, how can we make that work? And I absolutely loved it. And when you love something, I think lots more things start to happen. So again, I was delighted. I love that it was hands-on. I was involved from start to finish, and I realized that those things are really important to me. And I was working with people that are lovely. So look for them. They're there. There's lots of people that want you to succeed in your career and want to give you a helping hand, and you're helping them too. So when I get to work with students, I always say, please ask why. Please ask. There's no question that is too basic, because the more you ask, the more our understanding for all of us improves. So, so what I got to do with this research is I got to present at the Association for Research in Vision and Ophthalmology, which is ARVO. And it was a meeting in Florida. It's the first time I'd gone, to Florida. And I got to do this presentation, and it was wonderful. It's my first paper. In fact, it turned into two papers because I was having such a great time working with them. And so I wanted to take a quick little moment here to say that you have pivot points I think in your career. So I had been going along and I'd been thinking I really wanted to do neurology. Again, even this lab was looking at conduction in corneal nerve cells. And sometimes if you're a little too goal-oriented, you can miss things. So there's huge advantages to being goal-oriented. I'm a type A personality. I bet a lot of you guys are as well. I don't even know if they call it that anymore. But, we're people that we like goals, and we start moving towards those goals, and you get accomplishments which help your CV, and you are more likely to achieve your goal. But do take some time to, look around, what's going on. Again, what are the things that make me content? Don't kind of buy into, oh, it has to be this one thing, because I think you'll miss opportunities for personal growth. And so one of the things that I did is I started thinking about ophthalmology. So I wanted to break it up a little bit by putting this poll out there. How many students do you think that from the beginning of medical school to the end of medical school change what specialty they're thinking about doing? So I have a bunch of different answers, and I see that Danny has opened up the poll. So I'm just curious what you think. This is the data I'll give you is from was from 2000 to 2017. So it's a little bit older, but it's before the pandemic. Yeah, I think it looks like most people have answered. So, and I think you can see the screen as well. Absolutely right. It's 50% of medical students in 50% of students change their mind. And it does vary when you ask the question, like if you've done your gross anatomy class or you haven't. And it also actually matters what specialty you pick, which I was surprised to see that evidently orthopedic, I think you can see it. I'm hoping that you can. Anyway, orthopedic surgeons tend not to change their mind as much, but the rest of us, we're open and asking questions. And about 50% of medical students from first year to where they decided to go change their mind. Okay, I am going to see if I could stop that and then move on. Okay. Okay, I think I don't seem to be able to advance. Oh, there we go. Okay, so the next part of my career journey was I went to UCSF for medical school, and I was still a little bit more goal-oriented than I think I would advise others to be. I know that a lot of times people are, one of the first things kind of medical students go talk about is, well, are you going to do medicine or are you going to do surgery? As if that's like some like major dichotomy and like the two never meet. That's not really the truth. Again, go in asking lots of questions. I was thinking a little bit about ophthalmology and still thinking a little bit about neurology. And if I had to do it again, I would have a holistic approach. I would say, you know, try to determine what you enjoy, what type of lifestyle you think you would like to have, and what stresses are comfortable for you. So, you know, some of the advice I have about choosing a subspecialty is talk to as many people as you can. If you can possibly shadow with someone and do some ancillary involvement, I would call my research a little bit of ancillary involvement where I was getting to work with people who are doing research, but also had some clinical duties, so I could ask them about that. I think that you want to be fascinated by the subject matter that you're working with. That's a good sign that you're in the right specialty. And you want to like who you are when you're kind of working around that subspecialty. So if you're stressed and you're just feeling like angry and the people are all angry around you, you really got to think, is that something that I want to do for the rest of my life? And then I'm going to throw in here that you also need to assess your needs outside yourself, like family, relationships you're having in spouses, you know, what kinds of different things is the career that you're moving towards. You know, what some careers are a little bit more conducive to having an outside family life and other ones a little less so. So just kind of listen to what the people who are doing it are saying to you about that. Do you have time to do research when you're in medical school? I certainly did. I think that you can tell that I really loved clinical research, and I started working in a lab at UCSF with Dr. Jenny LaVale. The kind of overarching theme of my journey is the people I met had a huge influence on what I decided to do. So in her lab, we looked at herpes simplex virus in retinal pigment epithelial cells. So again, we're in the eye. And I think one of the problems I have is I don't think medical students are exposed to ophthalmology as much as they are to some of the other subspecialties. So if it's something you're thinking about, do approach people. Again, most people really want to talk to you. My research in medical school did not produce major results. This is back in the old days when there weren't commercial gels that you could buy. So we had to plate our own gels, and I had a lot of trouble with Western blots. But I did work with fantastic people. And I learned one more thing about myself in this research, that I learned that I really love when there's direct clinical application to the research that I'm doing. So it's harder. I don't really love working in a lab with the Western blots. I really like doing more clinical research. And then I started getting ready for residency. So at this point, with the people that I had talked to, I had really committed to ophthalmology, and that's what I wanted to do. So now I'm getting ready to go into residency, and I wanted to put one more poll out there about what % of residents are going to continue to practice in the state that they do their residency. So I was curious if you guys have a sense of that. Because it's an important thing. I mean, you're going to be there for the residency, but what does it mean long term? So I know that I heard that a lot of people are from California that are joining in. This is from that same data that I was telling you. And interestingly, California beats the trend. I think it does it for a lot of things. As a native Californian, I'm going to claim that. So in California, the percentage that stay after residency is 77%. I didn't include that as an option because the correct answer is actually 57%. So the majority of people, oh, good, thank goodness. I think Danny is sharing the poll. Can you thumbs up if you can see the poll results? Okay, thank you very much. I appreciate it. Okay, so let me stop sharing. So it is really important where you decide to do your residency. Again, 57% is not 100%, but it does make an impact on most people where they decide to live. So was not aware of that statistic, and I decided that I wanted to leave California and go to Pennsylvania, to Wills Eye Hospital for my ophthalmology residency. I really didn't think that I was going to stay. All my roots, my family, everybody's in California, and I thought I was going to go back. But I am so excited that I did go to Wills Eye because there were resources all around. So it is an entire hospital of ophthalmologists, not just like 2 or 3 people. And I thought that that was fantastic. So you were immersed with people who love what you love, and you get to have discussions that are interesting, lots and lots of learning opportunities. And I just adored the people that were in the residency with me. Most of us have stayed friends, and I think that they are so talented and amazing people. And I hope that you get that opportunity as well when you do your residency. And one of the things that ophthalmologists tend to do is to subspecialize. So you can do general ophthalmology, which is dealing a lot with cataracts and things that happen in the front part of the eye, or you can specialize and decide to work just on the retina. You can do the plastics, which is the lids and things around the eye, corneal diseases or glaucoma. And I had the opportunity to work with Joe Calhoun, and he is the next person who had the greatest impact on my career. So mentors can change your career path is the theme of these slides. I did not think I was going to go into pediatric ophthalmology. I do enjoy working with kids, but I had never thought that that was my calling in any way, which is a little bit unusual. Most people who love the pediatric specialties actually know that they really like working with kids. But there were lots of things that I got when I worked with Dr. Calhoun. One of them was the kind of amazing feeling that you get when you have helped someone recover their vision, especially if they're a child and they have their whole life in front of them. And I also loved that he had relationships with these children, and they had started with him when he was, when they were babies, and now they're off to college, and they actually would bring their kids back to see him again. And now that I've been in practice long enough, the same thing has happened to me. So that's definitely a component of the pediatric subspecialties. Also, working with kids is so fun. You essentially have their wonder is communicated to you as you are examining them and getting to work with them. I also find that pediatrics, I love the subspecialty because the trajectory is up. In other words, kids get better. I find that some of the other ophthalmology subspecialties, their vision is getting, things are maybe on the more downhill side. Although there are wonderful joys that you get with working with all groups. And again, remember I had said, be fascinated with your specialty. And I did feel fascinated with everything that I was learning. And I liked the self I was when I was getting to work with pediatric patients. And so I decided I wanted to do pediatric ophthalmology and did my fellowship year. So after 3 years of ophthalmology, I went ahead and joined Dr. Calhoun for a one-year fellowship. And I do believe learning is lifelong, but in order for you to get the most out of it, you need to know what's already been done. And I love that Dr. Calhoun, these are the old days again, he would have a cabinet and there'd be all these articles that we would have to read. But he would say, listen, let's sit down and talk about these 5 articles that I, had in the list. So I love that interaction. He had the focus of saying, you really need to make sure that what you're investigating is applicable and important. He had a couple of sayings that I'm going to share with you. He would say, you cannot improve the symptoms of an asymptomatic patient, and you want to keep that in mind. And he would also say that patients are valuable humans, and we should never be doing something that's experimental on people. So, and I'm just going to share this last thing about Dr. Calhoun. What he taught me is you are never too old to ask why. This is actually a question that he asked. So we would all get together for the fellowship, and before the day started, he would say, okay, these are the things, I want to talk about. And one day he said, I want to talk about why in the world did Nixon form the committee to reelect the president? And yes, that's what my mouth did. I was like, anyway, so he would always ask questions about why, keep asking why. And the second most important thing that he taught me is that you need to have your priorities in order, and your priorities need to be to take care of yourself first, to take care of your family, and then to take care of your career. And I think that all of you need to know that that's really important, and surround yourself with people who kind of believe that and help reinforce that in you. I wanted to talk a little bit about the clinical research. Again, what I had learned about myself is I like to be hands-on. I liked research that was clinical, and I really liked the people that I had worked with. So these things are important. In residency, I got to work with Bill Tasman, who had done so much work in retinopathy of prematurity. So premature babies had a retinal condition where they would get abnormal growth of vessels, and Dr. Tasman had done so much work to try to save these babies' lives. And so my co-resident, Christine Chung, who I have a picture of up there, we did a project with Dr. Tasman that we were able to work on. And then I also got to work with one of my mentors in fellowship, Dr. Bruce Schnall, and we worked on looking at probeans, which are 6% of babies are born with their tear duct blocked, so they get tearing when they're not able to have their tears go down into the nasolacrimal duct and down into their nose, and instead they well over and spill over. So we did a study looking at 2 different surgical procedures to try to improve that condition, and that was a lot of fun. And then the one that I did, the research that I did that I really enjoyed was in my fellowship. one of the things that we see a lot is adult strabismus. These are adults that have a misalignment of the eyes, and it can be quite large. And, we want to do surgery to improve it. And when it's really large, the question is, can you just do surgery on 1 or 2 or 3 muscles to get that alignment to improve? And there was some controversy about whether it was 2 or 3. So Dr. Calhoun would do these, what I called Herculean amounts of surgery on just 2 muscles to see if you could just do 2 and still get the correction that you needed. And so I just put this in here because I know ophthalmology is not everybody's love, but in the eye, there are muscles that are attached to the eye that you can see right here. And what we do when we do strabismus surgery is we take the muscle where it is and we move its position to create more or less tension in the field of action of that muscle, and that moves the position of the eye. But when you're doing Herculean surgery, you are moving that muscle very, very far back. So the eye is a globe, like a ball, and the muscles are normally at the 8 millimeter mark. I don't know if you can see my cursor, but around the 8 millimeter mark here. And if you're moving a muscle 13 millimeters back from where it started, you're here, you're way past the equator of the eye, and it's technically very difficult to do. So one of the reasons that I really wanted to do this research was, is this surgery really what we should be doing, or should we say, no, you need to move on to the 3rd muscle? And it resulted in this paper, which said, you don't need to do that really, really large surgery. You're only going to get so much effect. You really need to move on to the 3rd muscle. So again, it kind of went with clinically relevant, hands-on research. So, and I just wanted to stop for 1 second here, because I'm all talking about all the things that I love about my career. But one of the things that is really important is that life is not a linear path. And when I finished my residency and fellowship, I decided I was not going to work full time. I had my first child. I was working part-time at this point at St. Christopher's Hospital for Children, and I loved getting to spend time with my own children. You're not a resident or fellow anymore. You're the authority, but you're also the authority of your own life. You get to decide, do I want to keep going at this pace? Do I need to take a step back? And in fact, I had twins after that, and they are the most important thing I've done in my life, is having a family. But I did do little things. I did case reports during the time. There was some interesting, a patient came in who was camping, and they had a lightning strike near them, and they developed, unfortunately, a macular hole. Now, luckily it repaired, but that was a case report that we wrote up, and then some other cases. So when you're, even if you're not all in, just remember that you can stay active with case reports. And I also did teaching. So I really enjoyed working with the residents, both at St. Christopher's as well as Hahnemann. And I did get to work with the Wills Eye residents again. And I would think about what would have helped me. And I set up a strabismus suture course, and getting people to do hands-on training. And I also was able to give some lectures at Wills on pediatric ophthalmology. So the people that I had kind of had relationships with in residency, I kept in touch with them. And then when presented with the opportunity to give those lectures, I took it up. And I wanted to pivot away from my own career and talk to you a little bit about pediatric ophthalmology. A lot of people may not know a lot about it. In fact, it's a relatively new specialty. It was the first person to become a pediatric ophthalmologist was in 1943. Frank Kostenbader decided that he was not going to see adults. He was only going to see children. Before that time, anything that needed to be done in ophthalmology, people were waiting until they were school age. And now we know that that so misses the boat. If you don't, vision is a learned sense, so that if you don't use your eyes, and you don't, if you have any impediment to being able to see, the occipital lobe in the brain, where vision will be recorded and analyzed and brought to fruition won't develop properly. And so by waiting until school age, it was, game over, you missed it. Pediatric ophthalmology started emphasizing the importance of getting in infancy and childhood. And then they started training others to be pediatric ophthalmologists. And the first people ever trained were by Marshall Parks in 1947. And it was at the Children's Hospital in Washington, D.C., which is now called Children's National. The most common pathology for pediatric ophthalmology is a misalignment of the eyes, or strabismus. And so the emphasis of these pediatric ophthalmologists became strabismus. And it's amazing. By 1970, they were having these annual meetings. Remember, we're just kind of there training like one person at a time, one person a year. But by 1970, 24 alumni got together and they called it the Kosten-Bader Alumni Society. But the membership, of course, expanded as the people who had gotten trained by Marshall Parks went out and then trained others. And so as more people had training, we formed the American Association of Pediatric Ophthalmology and Strabismus. And then they decided to have a research kind of focus. And that was back in 1992. At one of the meetings, they said, does anybody really want to do a multi-center trial? If you do, stay after the meeting. This is before my time. But essentially a group of 20 people got together and said, let's, what do we want to do if we want to do a multi-center trial? A lot of people have strong opinions about what is right. And when you do a multi-center trial, you have to have people to kind of buy into, let's investigate this. And you had to set up very specific criteria to make sure that you were comparing apples to apples. Were there parts that were going to be left to the investigator? But the more you let people do what they thought was best, with their discretion, the less generalizable the result, and maybe you would lose data. So again, it's all about the people. These three people decided that they were going to form this group called the Pediatric Eye Disease Investigators Group. Dr. Jonathan Holmes, Roy Beck, and Dr. Michael Repka, Dr. Beck as well. I didn't mean to. Dr. Beck is a neuro-ophthalmologist, and both Dr. Holmes and Repka are pediatric ophthalmologists. And they pretty much decided that they needed to have researchers to ask questions, that they were going to have a data collecting center, and that they needed funding. And the first trials was started in 1997. Now, this is about the time that I'm starting to finish my training. And they decided to focus on amblyopia. Remember, I talked a little bit about amblyopia as the development of vision, that's the linkage between the eye and the brain. And they were going to look at some simple protocols and have vision as their primary outcome. I promise I'm getting to the relevant part. The PDIG sites, just to let you know, so 1997 they start. Now there are over 244 different universities that participate in these PDIG trials. I say universities, but actually there are many community sites as well. And I just kind of put that they've even they have people participating internationally. They've done 51 studies, and it's actually more than 7 right now, with a tremendous number of publications, as well as national presentations. And I just put a smorgasbord of some of the different topics that they look at. It's really heavily focused on amblyopia and the bread and butter conditions that we see as pediatric ophthalmologists. So remember my hands-on, and I love clinically relevant things. So again, this is conditions you see every day. There were some mysteries, like you do the same treatment, but some kids would get better and other kids did not get better. And so what were we missing? There were some treatments that have multiple different options. And typically, if you see a disease that has multiple different treatment options, it can be because either it's multifactorial or we're not really understanding the pathophysiology. They did this investigation on amblyopia, as I said, as their main topic. So some things happened for me as well. So as I'm practicing, I decided to join Dr. Calhoun. He invited me to come back to Will's and join his private practice, which I did. And so you start doing things just like your mentors did them. But then, I had my own cases. And embarrassingly, when things go well, you just go, oh, of course, that's how it's supposed to be. But when things don't go as you want, you get an unexpected outcome, you kind of never forget it and you dwell on it. And I'm going to say that that's sometimes where you start thinking about, wait, is there research that can help us to kind of understand this better? And so you want to make sure the research is meaningful and is it going to change what I do? So I want to show you an example of how being involved in the pediatric trials really changed what I do. And don't worry if all of this is not understandable. I just want to kind of give the bigger point that when I did my fellowship, and you'll see this too, you have authorities that are teaching you, and they say, this is the way it is. And these are the things that I knew about amblyopia. So younger children, the younger you were, the faster your recovery. So you had to be really young. Boy, better not be over 10 years old. And the worse the vision was when you started, the harder it was to get it back. And anisometropic means when the decrease in the amblyopia or the decrease in vision is due to glasses, that was going to be easier to correct than if it was due to strabismus or a misalignment of the eyes. And then here's this thing where there's two different treatments and different amounts of treatments that you can do. But the point of this slide is really, don't do the Walter Cronkite, like what he says is the way it is. No, because if you go back on the pediatric trials, they proved that that's not true, 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 and that's not true. So in 20 years from when I did my fellowship to where I am right now, by investigating and doing this research, you find that this bread and butter condition that we treat, there's a lot more that we don't know about it. And a lot more we're learning about it. So I have been a principal investigator involved in studies looking at different treatments. I've been on the writing committee for adult onset divergence insufficiency and a steering committee for amblyopia, as well as now I get to be a co-chair on a different treatment for amblyopia as well. So I've really enjoyed that part of my research. I think that what I want to end with is that it is really all about the people. It's who you kind of associate with, develop relationships, and take chances. And that's essentially how I got to be the chief of pediatric ophthalmology now. So thank you so much for your attention. I hope it was somewhat interesting. And I'm working on a lot of different projects, but again, make sure that you always keep asking yourself questions about what makes you happy. So thank you so much. I'll
Thank you. Yeah,
stop
thank
sharing.
you. Yeah, thank you, Dr. Gunton. I think we can go ahead and ask some questions that were posted in the Q&A. The first question that was upvoted was, do you have any advice on navigating research opportunities?
I think that what worked for me the best was trying different things. As I said, when I was first at Stanford, I went into one lab and started working with them. If you talk to mentors, people who are either assigned to you in college as, oh, I'm, helping you decide based on where you think you want to go at that time. That's how I got to my first lab. And how I got to my second lab in college that I absolutely adored was that in the lab I was working, I started asking people about other labs and what they were doing. I didn't say I don't like this lab. I just said, what are other people doing? And they said, oh, these people are doing this. And so I think if you just ask questions, that's the best way, and talk to the people who are assigned to you as mentors and listen to what they say.
I think that's super valuable, especially coming from you and coming from like a working professional. It's learning from your mentors is really, really characteristic. Okay, so another question that we got is, what other specialties did you consider before pediatric ophthalmology?
So I talked about I was going to do neurology, and you heard how that kind of, so the main reason neurology fell off the, I like this, is that I decided I really like to be hands-on. I like to do things with my hands, which I think meant to me I wanted to do something surgical. And so I then came up with ophthalmology. And it wasn't until my third year doing ophthalmology, the last year of of your residency, that I decided pediatric ophthalmology. What happens is that you get exposed to different subspecialties during your residency to see what you like. And for me, pediatrics ended up being later in it. And it was funny. I was not good at that point at asking, like, oh, when do I seem happy? Like, when do I feel like, wow, I really like this. This is fun. And the answer was, I was kind of good. I was kind of like, oh, I like everything. Everything's fine. And then I had pediatric ophthalmology, and it was like, it was laughing and having fun. And I think that, I think it wasn't until I did my pediatric ophthalmology rotation that that's when I decided, wait a minute, this might be for me. And I actually had to have it pointed out to me by one of my co-residents who said, you know, you kind of light up when you talk about pediatric ophthalmology. And I was like, oh, no, 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 that's not going to be me. But then I started kind of thinking about it more critically. So that's why I said, kind of stop and take a little bit of time to see what makes you happy.
Yeah, I think that's such a interesting answer that not a lot of pre-medical students hear.
Sorry, I don't know if that's good or bad, but
No, that's great.
but it is the
And
truth. I really do think, keep asking. Yeah.
okay, another question we had was, I've currently been interested in ophthalmology for a while. Do you have any advice on how to look for ophthalmology research gap year opportunities?
So I think that if you have an ophthalmology program at the medical school where you are located, that the best resource is to talk to either the residency director, or if they have a designated person who does research for that program, because they can help you tie in to get those research opportunities. It's tough. You have to kind of scour the internet and look for things. There are some research opportunities that are funded. Wills-Eye, for pediatric ophthalmology, we have a grant that supports a 1-year research fellowship. We like to take medical school students, usually not, just because you have a little bit of background once you're in medical school, just to have the clinical background. You don't have to have any ophthalmology experience. We just like the clinical background of medicine. And we have a funded one. There are many programs that have a fellowship year that's not funded. So I would ask through your medical school, if your program doesn't have an ophthalmology program, ask in the neighboring schools. Someone's going to have an ophthalmology. Ask them, because if you can get tied in locally, it's very expensive to travel. It's expensive to get far away from where you are. So that's how I think I think that would be the best way to get to do that. I get emails from medical students, and as many as we can get involved in projects we do. We just have the one person who's our fellow, though, our research fellow.
Awesome. Thank you for that answer. I think I'm going to tie in some two questions. This one is from a high school student who doesn't have a lot of connections with people in the medical field. How do I find a mentor? And then also, if you could describe the qualities of a good mentor or mentorship.
I think that it's a relationship between you and I'll answer the second part first, and then the first. It's a relationship between you and your mentor. So what do I mean by that? I think a good mentor is actually interested in who you are, in what your interests are, and in what you're doing, and they listen to you, and they kind of use the experience that they have to kind of open you up to other possibilities. So someone who's interested in you takes the time to meet with you and talk to you, and you are not a cog in a wheel. That's not a mentor. If it feels like it's, you are the only one helping them, and they're not talking to you and being involved and excited, then look for other people. And you know what the truth is, that I don't connect with everybody, and you're not going to you're going to have to go through different people to find the person that you connect with. And mentors are the same as students. There's some that you just connect with and you're like, oh, I want your career just to go, let's see what we can do. And then there are other people that you just didn't really have that same kind of connection with. Okay, so those are the qualities I think of a good mentor: making time for you, being interested in you, and having experiences. And then in regards to in high school, um, uh, so I was at a really tiny high school. We didn't have, but even I had a university that was about 25 minutes away from where we were. So I think that with the world that we live in now, you can email and reach out and say, I'm a medical student, and during the summer especially, is there a way that I can shadow? And what I might do is start off with shadowing to see if there's a little bit of a relationship that you can build there. And then, when sometimes you just, again, spend time with people, you shadow with them, and then what do you know? There is a project that you might be interested in being, in something that you could work on. So I've had medical students come and shadow with me, sometimes short. In other words, like they can only do it for a day, but sometimes a week. It depends on the schedule. But that's probably what I would try to do is maybe cold call, or who's your eye doctor? If you're interested in ophthalmology, who do you go to? And then say, oh, where did you train? And do you know anybody? And can I shadow with you? Yes, some people are going to say no, but ask. If they say no, it's nothing against you. That's just maybe they didn't have the time. There was something else going on. But if you ask, you'll be amazed how many opportunities kind of serendipitously come up.
That's really good advice for everybody. There's another question. Do you have any advice for reaching out to research professors as an undergraduate student?
Yeah, I think so. I know that some of the other ophthalmologists at Wills, they love it if you have skills. So let me be clear. Big data is like the new cool thing in ophthalmology. It's like, we want research on, 500,000 people. So it's mining big data. So if you have a skill like, wow, I love statistics, and I have this background where I know how to manipulate, or not manipulate, pardon my use of that word. I'm really a good statistician, highlight that. So like kind of make an inventory of what your skills are and put together like a little cover letter, a little mini CV of these are the skills that I have. I can program. I mean, if you can program, whoa, that's awesome. I speak Spanish. Put your skills together. See what you have. You'll be amazed. You're probably so talented and you haven't really just categorized it. And then give that letter when you talk to, so you're going to send an email to the person doing research that you might be interested in. Google them, find their article. You can get access to articles, usually free through different universities. If you don't have that, ask your school to get you the article, read their article and see, was there something that you really liked about it? Because in your initial email, if you can say, Alexia is saying that she has a better answer, but that's good. But that's my advice. Email them, put a little something personal about their research, and put a CV together about your skills.
Yeah, I think that's really important. I think putting yourself out there, putting your skill set out there, and reaching out to professors is such a good advice that not many people get told or know.
Yeah, and I hope that that when we get to work with you, it is such it's just like one of the best parts of my clinic day is getting to work with the students too. You ask questions, you make us excited, you kind of like reinvigorate the older, like I'm putting myself in that category. And so you should know that what you are offering is hugely valuable too. Okay. Sorry.
No, that's great. I think it's something that students need to hear. We have two final questions. The first one is more about the field. How does one mitigate blue light damage since we're exposed to it through all our technology and everything?
Oh, I love this question. I get asked this question very frequently. So, blue light is part of the spectrum of light. It's part of the normal spectrum of light. In the morning, we're exposed to more blue light than we are in the evening, even if you don't open up a computer. That's just the way it is. Blue light itself is not harmful to the retina. It is not toxic to the retina. It's not so that's not true. Studies have been done that have shown very clearly that blue light is not harmful. So why is everybody concerned about blue light? Well, it's because you get a little bit more blue light coming off of your screen than you would in a normal day, be exposed to blue light. And some people are very sensitive to blue light in changing their circadian rhythms. So what happens is we're set up that if you see blue light, it's time to wake up. It's morning. Go off you go. And as blue light gets lower as later in the day, okay, it's time to go to sleep. So if you expose yourself and you're one of the people that are sensitive to this, then if you're on the computer, you're going to have a hard time falling asleep because your brain has been told that it's time to wake up in the circadian rhythm aspect. So what I tell my patients is, if you want to, there is a blue light filter, I think, in your screen that you can you do that actually in the screen itself. Try it. If you say, wow, I just feel better, go for it. Do it. You may be one of the people that's sensitive. Do I have people go out and buy blue light glasses only if they want to? I do not recommend it. If you use them and you find them helpful, I say great. You're one of the people that is a little bit more sensitive, but there's no toxic damage to the retina from blue light.
Awesome. Thank you so much. And I think we have time for one more question to wrap up the session. What has been the most challenging part of being a pediatric ophthalmologist?
Oh, that's a good question. I think that the most challenging part has been that I thought if I specialized and subspecialized enough, I would know everything about the field. This is going to seem so arrogant. It sounds arrogant as I'm saying it, but I think when I was in medical school, I was like, oh my gosh, there's so much to know. It's a huge volume of information that's kind of out there. And I thought if I could just know everything about one little thing, then I would be great and I would never feel like, oh no, I don't know the answer. And the truth is that the most challenging part has been you just don't know everything. No matter what little tiny thing it is, you're not going to know everything that could possibly be known about that. And so you're just going to be constantly learning. And it's both the hardest part, but also the best part, because it's not static. You're going to find that your career continues to challenge you. So I hope that's been the most challenging part, just doing the best job I can.
Thank you so much. I think we learned a lot, not only about the field, but also your journey in pediatric ophthalmology. And I think it gave us a lot of good advice. And I think a lot of the participants will take away a lot of good advice from this session. I want to thank you so much for joining us. And for the participants that are joining, or there's another session on building a successful MCAT study plan with Kaplan. So I want to thank Dr. Gunton for joining us and speaking about her career and her journey. Thank you so much.
Thank you so much for the opportunity.